Hello, I'm Dr. Lynn Mielke, and I'm going to tell you 5 critical things you need to know about Lyme disease. Number 1, what causes it? Lyme disease is caused by a corkscrew-shaped spirochete bacteria called Borrelia burgdorferi. There are also many co-infections that can also be transmitted at the same time, such as Babesia and Bartonella, that can coexist with Lyme disease and make it much worse. Number 2, how do you get it? The most commonly accepted way is to get a tick bite. Many people who have Lyme disease have no memory of a tick bite because often the ticks bite and fall off. They don't always embed. But some people hypothesize that other bugs that suck blood for a living may be possible Lyme transmitters, and there may also be possible sexual transmission between partners. Patients have Lyme disease on average for 10 years before it is correctly diagnosed. Number 3, what are the symptoms of it? The symptoms of Lyme and its co-infections are many and are varied and non-specific, which is why it is often mistaken for something else, such as MS, fibromyalgia, or chronic fatigue. The symptoms include severe fatigue, muscle aches and pains, brain fog, including memory and concentration problems, joint pains that move around, headaches, abdominal pain, muscle twitches, numbness and tingling or electric shock-like sensations, flu-like symptoms that come and go, soreness in the soles of the feet, air hunger, swollen lymph nodes, and skin reactions that can look like a circular bullseye rash or a linear rash that looks like stretch marks. Number 4, how do you test for it? There are many kinds of tests for Lyme and its co-infections. Most Lyme tests are looking for the antibodies your immune system makes against the infection. The problem is that the infection knows how to hide from your immune system. The standard Lyme antibody test that many doctors run is inaccurate a lot of the time. The Western blot is more accurate, and the IGeneX immunoblot is more accurate again. There are also other lab companies that have good quality specialized Lyme immune tests, and there are Lyme culture tests as well. The important thing to remember is that just because a doctor has told you that you don't have Lyme disease doesn't mean that you don't have it, because many doctors are not Lyme literate and many of the tests are inaccurate. Number 5, how do you treat it? Since Lyme is a bacterial infection, it can be treated by antibiotics or herbal antimicrobials. The average length of time to treat Lyme is often around 2 years, regardless of how it is addressed. I prefer to start my patients on aggressive herbal protocols 3 times per day and have had a very good success rate with this. I also find that patients tolerate the herbal protocols better without a lot of the toxic side effects of antibiotics. If Lyme disease and its co-infections are diagnosed and treated properly, patients can recover and go back to living a normal life.